I'm now going to introduce our guest speakers and ask them to give a brief overview of their enterprises. Please hold your questions until I open it up at the end of the panel for questions from the audience. First, I'll introduce Erin Green, Director of Student and Staff Services at Los Altos School District. Erin.
Hi there. Am I allowed to say good morning?
Yes.
Yeah, so good morning. I'm Erin Green. I'm the Director of Student and Staff Services in Los Altos School District. And I was the principal at Covington for a while before I moved into this role. It's really great to see all of you supporting the local community. And I recognize a few faces, which is so exciting. Claire Noonan, who's on the call. We used to work together in San Jose Unified School District as colleagues in education. And it's so wonderful to see you. And then one of my tennis colleagues is here too, Daphne Ross. It's just so fun to put all of the pieces together in the small community. So I'm really honored to be here.
Thank you. Can you tell us a bit about the school district?
Yeah.
How many people you serve, et cetera?
Absolutely. So Los Altos School District, we currently serve approximately 3,400 students. We have just under 520 staff members, and that's certificated, which means they have some type of credential, and also our classified staff, which means they're mostly student support and or supervisors.
Great.
Yeah. And we have 9 schools, 2 junior high schools serving 7th and 8th graders, and 7 elementary schools serving TK through 6th, transitional kindergarten through 6th grade.
Great. And Jonathan, Senior Director of Government Relations and Community Partnerships, El Camino Health. Can you tell us a bit about El Camino Health?
Yeah, thanks, Kim. Good morning, everyone. I'm really excited to be here, and thank you for the invitation. I've participated in this group and think it's a wonderful forum for just getting to discuss issues. Appreciative of the opportunity. So I'm sure some of this will be pretty familiar to you, but just a quick overview about El Camino Health. We celebrated our 60th anniversary last September. We started out as a hospital in Mountain View, and it's still the heart of our health system and where the majority of our services are delivered. We've also expanded our services in care locations with the addition of our Los Gatos Hospital, and we also have about 12 urgent care, multi-specialty care, and primary care locations as well now. We've historically focused on high quality care. We've been a nurse magnet hospital, which is held by less than 5% of hospitals worldwide, with a 5-star rating from the Federal Centers for Medicare and Medicaid Services. And recently we got recognized by Newsweek for being the highest rated non-academic medical center in the Bay Area. So we're really proud of that. Across our whole health system, we have more than 3,000 employees, about 2,000 full-time equivalent employees are here in the Mountain View area. We have 454 patient beds, 1,500 physicians who are affiliated with us. That doesn't mean that they practice here full-time. It just means that they have privileges at our system and connected to our system. We do the whole gamut of healthcare services, from ED visits to delivery, surgeries, cancer, heart and vascular, orthopedic care. Many other things that I could go on about, and a couple other things just to touch on briefly. We also have community health services, including a Chinese Health Initiative, the South Asian Heart Center, and our Roadrunners transportation program, which helps particularly seniors get to medical appointments, locations where they need some assistance. We also prioritize giving back to the community. Each year we financially support and partner with approximately 100 programs that are working to improve community health.
Hey, thank you. I have a few questions for each of you, and I guess I'll indicate who should start with each one. But the first question is, to what extent does the ability to find affordable housing in the area affect your ability to attract, hire, and retain staff and provide your services to the community? Do you want to go first on that, Erin?
Sure. So that's actually a really difficult question to answer directly. Affordable housing, it definitely will help our hiring and retaining of staff, especially with the newer teachers, because they're just at college and they typically start at the lower end of our teaching salary schedule. But I think affordable housing will definitely help with new staff. But that being said, we do exit interviews with all staff, and we lose staff due to, attrition every year. And it's not always due to housing prices, although that's definitely a factor. Many people are relocating just due to like during the pandemic, a lot of people moved out of the area just to relocate. Maybe a spouse gets a job in another state. People have stopped teaching and moved to other roles. We've had that this year too. Yeah, so it's hard to say if I think affordable housing will definitely help, and we want that, but I don't think that's the only reason that people would not be able to teach in our district.
Great. And John.
Yeah, thanks for the question. So we continue to be able to hire and retain staff that we need to provide healthcare services, but certainly the high cost of rent and housing is an issue, particularly for out of area candidates. Healthcare is really a nationwide market where nurses, physical therapists, doctors, pretty much everyone can practice pretty much in almost any community they want to in the country. And so, as people look to advance their career and maybe move up from individual contributor to manager to director, they'll often look at other health systems or other places around the country as part of advancing their opportunities. And sometimes candidates will look at the cost of living in the Bay Area and then they'll say, oh, well, I was interested in that position until I saw how much, rental housing or could never afford to buy a condo or a home versus, this house that I can get in other parts of the country. So certainly for some people that are out of the area, it's a barrier to hiring. On the retention side, kind of similar to what Erin said, there are a number of other reasons that people cite and exit interviews when they leave from, wanting to be closer to family, career growth opportunities. The pandemic also caused some people to kind of rethink their priorities, and in healthcare, people have the opportunity to interim position or a term limited position, and that's attractive to some people, and then they'll just take a break to spend more time with their family and friends and then take another interim position. So we've seen all of that. I would say also the housing kind of ties into just the general high cost of living that is a stressor for kind of pretty much everyone who lives in the city.
Great. Do you have a sense of what distances your staff are having to travel to get to work now? Erin, start with you.
Yeah, so most of our staff, I would say, is local. We actually have some people that come all the way from Los Banos. Like we have a group of a few people that carpool together and come, some of our operations team. We also have some people coming from Santa Cruz over the hill. And then we have some people in San Francisco too. And then actually some of our management live in the East Bay. So they come from everywhere. And I do know like the traffic obviously has slowed down just a little bit, and it's still a little more manageable, the commute. But we do know that we have people coming every which way. And since Los Altos is a desirable place to work, it's such a great place to grow and learn. People want to come here. So we're really fortunate that we work in one of the top districts.
Great. Jonathan, how about folks on your team? How far are they having to travel to get to work?
Yeah, I would say it's similar, and it's not always tied to cost of living, because it could be that, someone started their career at Kaiser and so they bought a home in the East Bay, or they were living in the East Bay, for a number of years and were renting there, and they like the community. So, as part of advancing their career, Camino is an attractive employer, and so they decide they want to work for us, but they may not decide that they want to uproot their kids from schools, or a spouse might have a job where they're located. So it's certainly similar to Erin. We have people coming locally and throughout the Bay Area, some people who choose to live in Santa Cruz. It's really a mix.
Great. For each of you, the next question is, what has the last 2 years been like for you and your enterprise or organization? How does that compare with the pre-COVID times? John, you want to start with that one?
Sure. I mean, I don't think it'll come as a surprise to anyone that it's been an incredibly stressful time for healthcare workers. We had to, actually the first confirmed case of community spread of COVID was diagnosed here at Camino hospital when the pandemic first began. And so just operating with that reality of COVID and the uncertainty around that and additional stresses. And our healthcare workers were also called upon to really provide even more emotional and social support than normal too for much of the past 2 years, just because there are less now, but there still are visitor limitations as part of preventing the spread of COVID. And so when you have less family members who can visit you, that emotional and social patience is also incredibly important, and our caregivers have had to provide even more of that than they did before COVID. Also kind of similar to in other professions, I mean, it forced people to kind of evaluate their priorities in lives. And some people decided that they maybe didn't want to work a 40-hour week, maybe they preferred a 30-hour week or 20-hour week. So then they went to part-time. People who might have been 5 or 6 years from retirement decided to move up their retirement. So I would say it's caused a lot of different factors in regard to people leaving the area. Some people decided they wanted to relocate closer to family because, in the past, you might have just been able to hop on a flight easily. But then that would be more of a barrier now because you have to take a chance of exposure before you might see elderly parents or something along those lines. And then also when so much was shut down here in the Bay Area, a lot of the attractions that people have historically liked and kind of exchange for the high cost of living here, weren't available as well. So some people decided that they wanted to move to a lower cost of living.
Great. Thank you very much. Given the hiring challenges you've cited, have you come up with any creative approaches to hiring and retaining people that have worked? We'll start with you, John.
I mean, I would say that, the biggest approach, something that has been a longstanding reality of El Camino Health is people really like working here. It's a very, within healthcare, it's a very high quality, high staff environment. Not all hospitals, most hospitals don't operate on the nurse magnet model. So for nurses who are practicing here, they feel like they have more support than they do in other health systems. People like the feel of a community health system. We're closer to the patients. We're not as large as some of the other health systems in our market, so it feels more personal. So I would say that one of the biggest factors has really just been that kind of unique culture and personal touch that and high quality that El Camino has long been known for.
And Erin, any creative solutions?
Yeah, so very similar to John. Our district has a lot of support, a lot of training, and we're known for our really robust and rich professional development that's personalized. So we really try to sell that, and we're a relational place and a relational district where you're not just a number. Like we're like a huge family, and I know that sounds cliche, but people want to come, and once they get into Los Altos, they don't leave typically. For teachers, I don't know if this is creative, but we really prioritize putting the best teachers in front of our students. And so when February and March come, we're really aggressive, and we say we need 20 elementary teachers to hire. And we might not have those particular openings, but we will go after the very best and the brightest. And what we do now is we offer just a general job. For instance, you're going to be teaching K-6 in our district, and you're going to have a great placement, but we don't commit to where people are going so we can get a lot of teachers. We hire with a pool in general, and we're pretty aggressive.
Great. I know you both have very large and diverse teams at a lot of different levels. Can you give us some sense of what affordable housing means to members of your team? Because we're, as you know, in the middle of this housing element that is supposed to provide opportunities to develop affordable housing at a variety of levels. But a lot of people I've heard say, well, that's what's affordable here is not affordable to me. But Erin, do you want to take that one first?
Sure. So we look at it two different ways. I would say from a single income household, do you want a number for what affordable is? I've heard from our staff that $1,500 to $2,000 maximum is what a single income person would be able to pay when we talk affordable. And so one of the things that has really helped us in the past before a pandemic, we had a close partnership with the Los Altos Community Foundation. And we were, I don't know if any of you were involved when we were looking for people that had ADRs and they would work and put teachers in their homes, but that was really successful. That was successful in getting people to relocate here because they knew they could come and work 5 minutes from their work and pay $1,500. So as low as it sounds, that's really what's affordable for a new single income teacher.
Kim, can I interrupt for 1 second? We're having some audio issues. I would just ask the guest if you could turn your speakers down because sometimes that vibrates the microphones. And also, John, we were having some trouble hearing you. If you could speak up a little bit, just keep your speaker down and close to the mic if you could. Thank you very much.
Thanks, Stu.
Same question to you, Jonathan. What's affordable mean?
So affordable, really, one thing that's unique, I would say, about healthcare services is you have people all across the income spectrum. And so affordable housing really impacts people at an organization like Camino Health, regardless of your income, even in areas where you wouldn't really think. For example, physicians, a primary care physician, while they may make a good salary in relation to other workers, they might have a challenge of, affording the down payment for buying a home in the area if they want to. And physicians actually get paid more sometimes if they go to more rural areas or more remote areas because it's even harder to recruit them there. So it can play a role for physicians, it can play a role for nurses, it can play a role for housekeepers, for food service employees. It really is across the whole income spectrum. The high cost of housing impacts people, and whether it's on the rental side or for those who may want to purchase one day and might make a decision that if they can't purchase something in the Bay Area, that may factor into a decision. Owning a home is a huge priority of theirs. They might choose to relocate out of the area.
I just got a message from Maria, and I do want to add to that because I didn't want to leave out the classified positions and positions that make less money than perhaps a certificated teacher would make. But affordable housing to our classified too is definitely at that lower. We can't pay very much in our classified and aid positions. And so really what we've done to fill that need is a lot of the aides that we hire are families in our community, like their parents that weren't necessarily looking for a job, but they feel compelled to support Los Altos. So they come to work in different capacities, like school secretaries and things like that are already in the community. But I didn't want to leave out that part. But yeah, some of our, like right now, one of our hardest positions to fill are our classified aides and our special ed aides, as well as we now have a new food service program, and people just won't be able to relocate here to take a job like that, making say $20 or $25 an hour. It's going to have to be somebody that's already in the community able to fill that role.
Great, thank you.
Welcome.
Next question.
Can I quickly add something that I think?
Yeah, sure.
For context, I think also it's important just for affordable housing for positions that are lower on the income scale. It sometimes shows up in overcrowding too. So I mean, that's one of the reasons that during COVID, certain portions of our county were more heavily impacted by infection rates just because people were living in more crowded housing because they had to form their own affordable housing, even if it wasn't officially designated as affordable housing if they were lower on the income spectrum.
Thank you. Thank you. Next question. Do you have any ideas about what federal, state, or local governments could do to help resolve the affordable housing challenges that you face in your organizations? I'll start with you, John.
So anything that helps address the demand supply imbalance in our area, I think is helpful. At a minimum, hopefully that mitigates the increases in housing costs that have kind of been a relentless drumbeat in our region for many years. And then certainly housing that is designated affordable is incredibly impactful to those who might make a wage where they can qualify based on their area median income for that. But really, there's just such an imbalance between the supply and the demand that anything that helps to increase the supply is going to help tackle the problem.
Yeah,
Thank you, John.
I would say the same things that John said. The designated affordable housing projects that we've been partnering with the cities on, and the affordable teacher housing that's coming, and that's definitely going to make an impact. And then maybe some assistance with down payments for those people that are ready to purchase in the vicinity. I think down payment help would be really helpful for some of our staff.
Great, thank you. And a final question, is there anything else you care to say that is important and germane to the topic of providing housing for your team members? I'll start with you, Erin.
Yeah, I think our schools are such great places, and to keep them great, we want to be able to have our staff, all levels of staff, work and live in the community, because that's what we're based on, is relational and community. I think if we could pick up our partnership with rental housing, that would be a great start. If we could get back to doing some of that and networking with our local families to provide more affordable housing, maybe in their ADR units in the back, with just more affordable condominiums, and maybe even shared spaces for teachers and staff, I think that would help. We're really just ready to partner with the city.
Very good. Thanks a lot. John.
Thanks for that question. I would just add that one thing that we've been fortunate at is having people at El Camino Health. Some people have been here 10, 20, 30, 40, even 50 years. Some people who've worked here since our hospital opened almost. And kind of having that continuity going forward, I think any steps that can be done to help make housing more affordable hopefully means that we'll be able to have that going forward versus having that being harder and harder for some people as they face other challenges in their life. The last thing I would just add, just as a healthcare provider, while certainly really happy to be here talking about our workforce, I just wanted to also share, every 3 years we partner with other hospitals and looking at a community health needs assessment, and housing is identified as a social determinant of health, and the high percentage of income that residents in our county have to spend on housing is also just a significant stressor, which causes them to have to make tough choices about, can they afford food? Can they afford healthcare? How do they save for their kids' college? So just wanted to briefly add that as well.
Great, thanks. Well, those are the questions that we'd prepare in advance. So if folks that are attending the session would like to ask a question, please raise your virtual hand and we'll call on you. And I want to thank both of you for participating in this panel today. Very illuminating, because I know for many people, well, I've heard from Larry Stone that the services your organizations provide have a great deal to do with the value of people's homes.
Of course.
So it's important, I think, for people to be understanding the stresses that members of your teams face and challenges you have in providing the services that make people's homes here so valuable. And that's, for most people, their largest single investment. So thank you both for what your teams are doing and for participating here today. And I'll go over to questions there. Gary, I see you have your hand up.
Thank you, Kim. You mentioned, and by the way, thank you panelists for your comments. That's great to hear from you. But Kim, you mentioned earlier about the housing element. This comes along every 8 years, so it's a very important thing for the city to be engaged with, all cities in the state. And I was wondering if either of you, the school district in particular, I'm wondering, have studied what's going on there and come up with. Are you going to be advocating for some part of it, or at least bringing this awareness to the elected officials, the council, but even more importantly than that, bring the awareness of how this could help you to the general public that may not appreciate what's going on? Thank you.
I didn't hear the first part of your comment. You were talking about an initiative and I didn't hear the beginning part.
Yeah, it's the housing element. It comes along every 8 years. And so are you studying that, and will the school district be taking a position? And for the reasons that I mentioned, it could be important if you did that.
Yeah, so I know we just had a leadership transition in our school district. We have a new superintendent and a new CBO who does our finances. And I know they were heavily involved in that before they left. And I do know that we're intending to get back to that and also to be involved in that. And I know we've been involved in the affordable housing piece too. So I would say, I don't know for sure, but I believe that we will be involved in that.
I hope so. Thank you.
Yeah.
Jonathan, is El Camino Health looking at that too?
So yeah, thanks for the question, Kim. It's hard to kind of for us to tie directly to like an individual community in terms of like this individual community, putting housing in this location is going to directly correlate to X impact on our employees. So in general, supportive of cities building housing, but also understand that it's really the community's decision too in terms of where housing goes and figuring out the specifics around that. And my understanding is a lot of it is really driven by kind of guidelines that the state has set and targets that were given to each community that really are outside of everyone's control. So trying to participate in events like this one and talking generally about the helpful impacts of housing, but that's kind of what we're doing at this time.
Thank you. Larry Barron, I see you have a hand up.
I do. So in the developments in Los Altos, 15% is reserved for BMR rate. Does anybody know how teachers or healthcare workers get on a list? And I don't know how these things are chosen by lottery, I guess. But does anybody know the procedure for actually getting in position to buy one of these BMR units?
Someone's got one.
Erin, John, do you have an answer to that? I see the next person with their hand up may be able to answer, but do you have direct information about how members of your team?
Well, I receive emails weekly about, this housing is available for this amount and you have to fill out an application. And I don't know for sure, but I do believe it's that they take the applications and then I don't know how they're selected, but they market them to our districts. We're getting them every week.
Okay.
But I don't know how they're selected. So if someone knows, I would love to know.
Yeah, John, do you similarly get such information from various communities? No.
No, I haven't had those sent to me, but certainly would be interested in knowing about that.
Yeah.
Okay, good.
Erin,
Sue, Larry, did you have more to that?
is it you know, in each of our developments, there'll be, you know, maybe 3 units that are
Correct.
BMR. So is it the individual developers that are emailing you, or is somebody consolidating these things?
That's a good question. Typically they come, I'm getting them from Mountain View a lot. That is a great question. I need to check into that, and I don't have my email pulled up.
Well, thanks.
Let me look. I'm looking right now if I can.
I'll note that we have a session planned, I forget the exact date now, with the
September 9th.
September 9th, with Randy Suda of Alto, who is contracted with the city of Los Altos to handle the BMR program here. And I think he also has somebody participating in that program from Mountain View. And part of what we want to be looking at is what are the best practices that the city of Los Altos might think about, how that's a lot of what our mission is about for the coalition: best practices, educating ourselves. So that really good points people are raising. Sue, I see you have your hand up, and I think you can probably shed a lot of light on this too.
Well, Jonathan probably could too, and Sally, but I think that Los Altos does have the school districts as a priority, so that's why they're getting the notices in Los Altos. But Mountain View doesn't have those priorities, but they have a lot more housing available, and I think they just do a much better job in their general outreach of letting people know. But I actually wanted to ask a question of John Cowan, because in the Mountain View housing element, there were a number of sites listed as possible sites for housing that are owned by El Camino Health. And they asked to have them taken off the list because they said they weren't interested in building housing. And I had thought that years ago that I had heard from someone who was on the board that they actually were interested in building some housing for people who work there. And I'm just curious about that decision not to, not to be involved in that anymore.
Thanks for the question. So that really was about, in the housing element discussion in Mountain View, there was some discussion around the single-story office buildings on South Drive around the El Camino Hospital. And the concern there was twofold. One, have an ecosystem, and the medical and dental offices that form around a hospital are really integral to an hospital and the healthcare system's ability to continue to succeed. Really, the economics of those small medical offices as more and more challenging. That's one of the reasons that you've seen more doctors choose to sell or affiliate with a larger health system overall. And so concern there was not being able to have the current healthy ecosystem of healthcare services. And so certainly wasn't, we think housing is important, but also wanting to have an environment where we can have healthcare services continue to be developed and delivered to the community. There has been some discussion over a location on property on Phyllis near El Camino Real. So there's a possibility there that, of some sort of mixed use project could be a possibility in the future. But similar to others, I would say, while housing is important, the school district also has to, build schools and provide teaching services, and we have to be able to provide healthcare services. And, we have to also make sure that we still have the flexibility and the freedom to do that. And part of it also came up where the city of Mountain View really wanted to realistically calculate what they think will actually be built in terms of housing. So the city council in Mountain View also decided that it didn't seem definitely possible to calculate that there's going to be X amount of units on that site over 8 years. So it also was a decision on their part that they want to have the most accurate housing element possible and not do what has sometimes happened where, sites are listed as, housing is going to be here, but then it's not actually likely to happen.
Great, thank you. Sally, I see your hand is up.
Good morning, and thank you to John and Erin for answering questions today. So I'll just briefly touch on, I think, what the Alto housing, managing the BMR program. I think that was already clarified by Sue. Council has asked them to change to refine the process, and so that'll probably be rolled out right around the time that we have the housing element approved, I hope. And so it is centrally managed, though Jonathan might add further details if he thinks I've left something out. So I want to ask a question, and when we talk about the schools, and so Erin, this is directed your way. When we talk about the schools, we often talk about, oh, well, we need affordable housing for our teachers. But some of you may have seen, and Kim, I'm happy to share it with you afterwards, that the issue isn't just about affordable housing for teachers. The issue is actually about affordable housing for our students. So the data shows from Silicon Valley at Home that school enrollment has been declining, public, private, and charter schools for the past 8 years, and expected to continue to do so as families have to leave the area and so the students leave our school districts. And if you look at Los Altos's numbers, actually, we're the second highest drop in student enrollment in Santa Clara County over the past 8 years. I think it was some large number, like 30% or something over that. I don't know, it was a very large number. And so by the fact that we're losing students, that actually sets up an even more vicious cycle where our teachers couldn't afford the housing. Now our students can't afford the housing, and therefore there's less funding because there's less students, and therefore there's school closures. I mean, we look at Cupertino Union, I think, that is facing potentially school closures because we're losing funding. So we actually need, and it would be nice if the city could partner with the school districts to advocate for affordable housing that actually keeps the young families. Young families cannot afford Los Altos. And so we are actually setting up a vicious cycle, even aside from teachers. And so I wonder, Erin, if this is an issue that you're familiar with, that as enrollment drops, funding drops, and teachers are laid off and schools potentially shut, and what you see. And Kim, I'd be happy to share some of the information with you afterwards, because this was a revelation to me that it goes beyond just our teachers. We're losing our students as well.
Yeah, no, for sure. We've noticed the enrollment drop. And I think that's, excuse me, part of the reason that the staff attrition with our aides and with our teachers hasn't really, we haven't laid off people in the years because we have that attrition going on too. But no, we're down to 3,400. And, you know, I know when I first came to the district 13 years ago, we were over 4,000. I don't know the exact number, but I know we have dropped. And I know there's multiple reasons for that too, but people want to go to school in Los Altos. So I know when they have to leave the district, I know families don't want to leave the district because they can't afford to be here. But yeah, we haven't worked with that piece right now. We are working with the county. We now have a school linked community services coordinator who's working with our district on linking some of our underserved youth to services in the community. And I know housing is one thing that we definitely will be looking into.
Great, thanks. Yeah, very good point, Sally. And I would appreciate receiving whatever you have. And if it's information I can share more broadly, perhaps through a link with the coalition participants, I'd be happy to do that in the next email we send out about the follow-up to this program, a link to this video, and perhaps in the past we could do this again, send this information so others can be aware of it. Very good point, though. Jonathan, I saw you had your hand up. I don't know if you still had something you wanted to say.
Thanks, Kim. No, originally I put my hand up because I wanted to address the role of Alto housing, and Sally's right. I think Sue really did a very good job of explaining what Alto does and the revamp, and her comments were helpful. There is one thing though that I'd like to say, just in terms of the broader conversation that we're having. This is an important conversation, but I think we all need to keep in the back of our minds that the housing element is only one component of actually finding a solution to this problem. And Los Altos will have a housing element that is compliant with state law. And hopefully above and beyond that, it's actually useful for helping to have more housing built up and down the socioeconomic strata. But ultimately, no matter what the housing element says, at the end of the day, it's what gets built. So the housing element is the roadmap for allowing more housing to be built. But we all know that the price of land out here is incredibly expensive. I mean, it's as if we're talking about monopoly money, it feels at times. And because of that, Los Altos is going to continue to struggle to be able to build affordable housing for our teachers, for our healthcare providers, for our first responders, for our city staff, for anyone who wants to be a part of our community. We're going to get through the housing element step, but the real issue then becomes, how do we move from having planned for accommodating that housing to actually having that housing built? That, I think, is the really crucial step. And I wish I could sit here and tell you I have an answer. It's a much more difficult problem, I think, because simply put, it requires a lot of hard dollars and cents. So let's all keep that in the back of our mind, because I think that's where the focus really needs to shift in the next 6 or 7 months after we get our housing element approved by HCD.
Great, thanks. And before I recognize the next raised hand, I just wanted to add something to this discussion about the BMR and selection process. In the last panel, Richard Drager's Markets made the point that he thought workers at grocery stores ought to be included as essential workers. And I think people would feel that's true of many people in our community, and provide valuable services in a variety of ways. And so hopefully when we get to the discussion with Randy Suda on how this works in terms of best practices, we might be looking at how do we make sure that the people that we want to be part of this community have the opportunity to get on those lists and to be informed and selected. But I recognize what you're saying, Jonathan, that the housing element is a map for hopefully providing the housing, but the cost of land and market forces ultimately determine what's going to happen there. Janine, you have your hand up.
Hello, thank you, Janine Valadez, and I really appreciate the speakers and their comments. I'd like to make a comment first, and then I have a question for the speakers. My comment, I've heard a couple of other comments that have caused me a little bit of concern. I just wanted to say that I think it's really important that as we look at these potential solutions, that we don't necessarily solely tie loss of students in our district to the plight of the underserved students. And while that demographic certainly highlights and amplifies the issues that we're talking about in terms of the inability to find housing and all the downstream effects of that Sally mentioned, it's actually the larger issue, even if you can believe this, is the loss of this middle class, because it is the middle class that has the ability to have that discretionary funding and or giving that keeps the vibrancy of our community alive and allows us to have the best practices, the best personnel, the best solutions for the community. So it's really important from a marketing standpoint as we try to advocate in the community is to, yes, we want to serve the underserved, we want to lift all boats, but it's the loss of the middle class that is really hurting our community, and housing has a great positive impact on that. So my question is the following. In thinking about the personal and just autonomous priorities for say teachers or healthcare workers and other professionals, there's often this interesting push, pull, it's a tension between the desire to be close to where you work because of all the conveniences that brings and your ability to be part of the community. But then you don't want to be too close because maybe you need separation from your students or you need separation from your patients. And so there's this balance that has to be struck. My question to the speakers is, in terms of coming up with creative solutions for housing, and in particular, mixed use, because I know, for example, John, you mentioned the ecosystem that builds around hospitals, and that's very important.
Yeah.
And that may be a negative thing to building housing right around the hospitals. But at the same time, I don't think that housing and medical services are mutually exclusive. They can reside on top of each other or right next to each other. So my question is, do you find that tension that I talked about, being close but not too close, does that provide a disincentive to mixed use developments for your workers? Thank you.
That's a great question, because we're actually looking into that right now. I know that there's been talk of having a housing structure for, the service workers and teachers and officers, very close. And that's a difficult question, because some people see your point and maybe they don't want to live near their job, or they don't want, they want their separation, but I'm not sure that that's a huge factor, because I know I think it's individual. Like, I don't think there's one answer for that.
John, do you have any thoughts on that?
Thanks. I would say I agree with what Erin said. And the only other thing I would add about mixed use is I think that definitely there are certain types of mixed use projects where, just from a function perspective, I mean, the primary care office or an urgent care can be located in the same building. I wanted to highlight a little bit more, as often what comes into play is the costs that the developer has to incur to build a building like that. And you see this with other grocery stores or restaurants that might be beloved, and they might be in an older building. And then when a mixed use project comes along, the cost that the developer had to incur to build that project, the return on investment that they're looking at for that space may be above what a primary care doctor's practice could afford, or something along those lines.
Yeah, that's a good point, John. I've heard that too, that the costs of redevelopment of mixed use can price people out that could previously afford to be in the location. Shally, you have your hand up.
Hi, thanks. I just wanted to amplify what Erin said, just from some conversations that I've had with some of our teachers. Many of our teachers actually grew up in our community and are really happy to be teaching in our community. And so to Erin's point, it is an individual choice about whether you like being close to work. But I think everybody that I've spoken to agrees Los Altos is a very special place, and our community is very tight, and people want to come back and live and work in this community. That's all. Thanks.
Great. Thank you.
And you're right, Shally, we do have more than 2 handfuls of teachers and staff working in our district who have gone to school here. They're alumni, and they want to be in the community that gave them so much.
Great, thanks. Hey, Claire, you have your hand up. And I think you're muted.
Hi, Erin, if you remember, well, let me start this way. In accord with what Shally was saying, when my kids went to school here, it was mainly their teachers were great teachers, but part of the community because they were a second salary. They could manage to live here because there was more than one income that was supporting their family. I'm wondering where we're working together. There were many really great young teachers that came into the school. It was a whole different situation, but they would have to leave after a few years because they couldn't afford the travel and so on to stay at the school. So there was that turnover.
Yeah,
some great teachers. So I'm wondering if now part of the problem in Los Altos even is with the new young teachers, do they have to keep leaving because they, the travel and so on to be working here overcomes even the good schools and the good situation for teaching?
Yeah, are you asking that, Claire?
Yeah, so I'm asking,
Yeah,
do you find that same problem?
I do. And I mean, absolutely. It's not everyone, of course, but there are every year. There's, we have some really amazing teachers, many, many, many. I mean, we have one of the most, a very strong school district. And I would say we get these pools of leaders. We get these teachers that have been here for 5 to 7 years, and we're tapping into them and thinking, these are our next leaders. And then all of a sudden, a couple of them are leaving. And yes, that's a good point. And then this year, I know because of the pandemic, people that were of retirement age, some of them went a little earlier than they were maybe planning on it. But I do notice that some of our people that retired this year were some of our longstanding Los Altos families and teachers who have been here for 30 years. And they were part of the first group that you described, Claire. And maybe your kids worked with them, I don't know. But yeah, we do see that. And it is disheartening because we spend so much time and energy, and then we have these relationships with them, and then they move on. And of course, we want to support people who are growing, but yeah, it's very difficult.
Well, that I always felt in all the time I was teaching that was a problem.
Yeah.
So
well, we had that when we worked.
I have plenty of sympathy.
Yeah. Well, you and I had that when we worked together in San Jose too. So it was kind of the same thing.
Yeah.
Great. Well, we're about out of time, and I want to thank our two panelists, John Cowan, Erin Green, very much for participating in the panel today. This has been very, very informative and has contributed greatly to the information that we're getting through our community coalition sessions. I want to note that our next session is on August 26th, Friday, August 26th, 8:30 to 9:30 a.m. with Erica Erickson, Policy and Program Manager, Early Care and Education at the Low Income Investment Fund. And this will focus to a fair amount on childcare and the challenges that affordable housing presents to having childcare for people that need it in our community. And also that panel will include Jerry Beltramo, General Manager and co-owner of Rustic House Oyster Bar and Grill. So we can get insight into how affordable housing impacts restaurants and other businesses in our community. If you'd like to be added to our email list, if you got here because somebody forwarded an email to you about this, but you'd like to get the emails directly, in the chat, you'll find the information about how to get on our email list. Essentially, just send an email to info@losaltoscommunitycoalition.org. I also want to thank the Los Altos Mountain View Community Foundation providing us with financial and in-kind support. And last but not least, we want to express deep gratitude to Larry Barron for all the work he does to help us make the videos of these sessions available on our YouTube channel. And again, please go, if you haven't yet subscribed, go to our YouTube channel and subscribe so we can get extra features there that are available when we get a certain number of people subscribing. So we're out of time. We're a minute over. Thank you all very much for joining us today. Really appreciate it and look forward to seeing you in future sessions.
Thank you, Kim. Thank you, everyone.
Thank you.
Thank you, everyone.